Okay, there we go. So now to introduce everyone, we are going to start with our moderator. Dr. Nita Farhani is the director of Duke's Initiative for Science and Society. She is, of course, my boss's boss's boss. She is a professor of law and philosophy here at Duke, and she is also a proud Duke grad, I believe, MA, PhD, and JD, all from Duke, a degree that she crafted herself. For the 7 years, I believe it was 2010 to 2017, she sat on the Presidential Commission for the Study of Bioethical Issues. She is also the co-editor-in-chief and co-founder of the Journal of Law and Bioethics. So she is well-versed in these subjects and excited to have her moderate. Nita, thank you for joining us today.
Thanks, Tim.
Michael J. Schoenfeld oversees communication and advocacy for Duke University and Medical Center. He leads our Washington, D.C. office, and he serves as our chief spokesman. He's also a visiting professor in the Stanford School of Public Policy. And the theme of today, a proud Duke graduate himself and a proud Durham resident. I think everyone here lives in Durham, so that's really wonderful. Welcome, Mr. Schoenfeld.
Great, thank you, Tim.
Mayor Pro Tem Jillian Johnson is the Mayor Pro Tem of Durham. She was first elected to City Council here in Durham in 2015. She was then appointed Mayor Pro Tem by Mayor Steve Schewel in 2017 and reappointed and reelected in 2019. I believe we have you now until 2023. Is that correct, Mayor Pro Tem?
That's correct.
Wonderful, wonderful.
Exciting
And again,
times.
a proud Duke graduate, a BA in Public Policy, a proud Durham resident, and she sits on so many committees on the City Council. I can't even name them all. We'd be here all day. So instead of doing that, I'm just going to throw it to Nita, and please send us your questions. We'd love to hear from you.
Thanks, Tim, for those warm introductions, and thanks to the two of you for joining today. We're really grateful both for all of the incredibly hard work that you have already accomplished on behalf of Duke and Durham and North Carolina, but also for the hard work that lies ahead as we hopefully move toward a stage of greater reintegration and reopening slowly in time. I thought we could start with just a few remarks from each of you about your experience thus far, both in terms of helping to guide us through this pandemic, but also in working with one another, and how Duke and the city of Durham are working with each other to have a more coordinated response. And so I thought we could lead off with Mayor Pro Tem Jillian and then turn to Mike Schoenfeld to be able to respond and provide some of those comments. And then we'll open it up for some conversation between us, and then open it up to the many questions that have been submitted by our community who've joined us here today. So Mayor Pro Tem.
Great, thank you so much. And thank you for inviting me. It's great to be here. So, like all organizations, right, like all institutions, this pandemic is an unprecedented challenge for the city of Durham. We have been, for the last couple of months, really, building the plane as we fly it, trying to figure out, what the best actions are to take to protect our residents. Primarily, our primary goal is the health and safety of the people that live in Durham, but also, trying to minimize disruptions as much as possible. We're very concerned about the number of people in our community who have lost their jobs, the number of businesses that have had to be closed down for public health reasons. And so it's been a lot of work. It's been a lot of really tough decisions, a lot of negotiations with people in different sectors of the community, sectors of the economy, to try to figure out what can still operate safely and what really needs to be closed in order to protect our community. We've seen we've had a close collaboration with our county public health department and with Duke, and so that collaboration has been really helpful and I think rewarding for us in terms of what we're able to do in the community. But we've also, we've seen this outbreak grow. We have a number of outbreaks especially in long-term care facilities here in Durham in the county, and we have residents being affected by outbreaks at places like Butner Federal Prison and other kind of congregate living situations in other counties. So we're very integrated, where the virus doesn't stop at 15501 or I-40. Folks are moving around, and all those essential workers who have to work, who have to be out there doing work that cannot stop. We know that we've got to do as much as we can to protect those folks as well. And unfortunately, due to the national situation, what we can do is limited. We're not able to find protective equipment for all of our employees. We're not able to access testing for all of our employees. So the city is kind of moving along, struggling along like everyone else in this situation, trying to do the best we can to keep people safe, and also to provide the services that we know that we need to continue to provide to our residents.
Mm-hmm. Wonderful. Thank you. Mike.
Great. Thank you, Nita. It's a great honor to be here, certainly with you and with Mayor Pro Tem Johnson. So thanks for the opportunity to speak to everybody. Let me just add a couple of things from the Duke perspective. As a research university, a major employer, and the principal healthcare provider for Durham, this, first of all, this didn't just happen last week. Obviously, this didn't just show up. We've actually been, and I'll talk specifically about the engagement with Durham, with the community, and with the state. We've actually been engaged with the city, with the county, and with the state since the end of December, when we got the first notice about the outbreak in China, which was in a city that many of us have been to because it's connected to our partner, our joint venture partner university in China. Mm-hmm. Long-winded way of saying we stood up all of our task forces and activities. We worked very closely with the city and with the state. It seems like 1,000 years ago, but it was actually, I believe, at the end of January, when there was a suspected case that might have come into to Durham. So a number of people at Duke have been working on this for quite a while in a number of ways, with Durham County Public Health, with the city, with the state, with RDU Airport, and others. So this really has been a very widespread and coordinated effort. In several ways, Duke has been very deeply engaged with the state of North Carolina through our hospital and health system. Our hospital leadership has been advising the Secretary of Health and Human Services, the governor, and others about healthcare issues, particularly around treatment, availability, bed space, availability of PPE, contact testing and contact tracing. So all of the things that you're reading about, watching, listening, and hearing about, we at Duke have been engaged with the state. Likewise with the city and with the county, again, on testing, on emergency preparedness. We have been working very closely with our colleagues in the city and the county on preparing modeling. Every couple of days, there's a new model that our data analysis team puts together for city and county leadership, so that they can test and assess various scenarios. From the healthcare standpoint, we are, as I mentioned, we are the major healthcare provider through Duke Hospital, through Duke Regional Hospital, through our clinics. That is, again, very much a coordinated effort. As an employer, and this is shifting gears from healthcare, there are 43,000 people who work at Duke. That they many of them span the world, but most of them are in Durham. So as a major employer, as the second largest private employer in the state of North Carolina, what we do has very significant impact statewide. So very early on, you have probably seen that Duke has been pretty forthright in being to the employees and being committed to our workforce. as Mayor Pro Tem Johnson indicated, the economic impact of this is still being written. It's significant and notable, and it will affect, it has affected and will continue to affect even relatively strong and sturdy institutions like Duke. So we do need to prepare ourselves for that. Likewise, on the education front, in addition to the 43,000 students, employees, Duke has almost 17,000 students. 7,000 of them are undergraduates, the majority of whom live on campus, but we have another almost 10,000 students who are graduate and professional students. Most of them live in Durham. Most of them are still in Durham. They're citizens of Durham. They're residents of Durham. They shop here. They work here. They have families here, and many of them are still here. Their job or their full-time job is, in many cases, as a law student, as a business student, as a medical student, as a doctoral student. So we have a very strong commitment as an institution, as does the city, to those individuals as residents of Durham. I should also add that we have now about 350 or so undergraduate students who are living on the Duke campus. These are students who were not able to go home. They're from countries where they could not travel to. Many of them are from China, and they were here when the university closed its residential operations. But they're also students who, in some cases, they're homeless. This is their home. In other cases, they have health problems. They were not able to travel, or they're being treated at the hospital for various illnesses. So we do have a cohort, a group on campus that will probably be here even after graduation. One other thing, let me just add that I hope you saw and others have seen that several weeks ago, the university announced and made some significant investments in support and relief funds, one for Duke students, one for patients and for research into COVID-19 at Duke Health, and then 3 different funds that with a total investment of about $5 million from Duke and more coming from other partners to provide both emergency relief, but also long-term anchor funding for nonprofits and for individuals in the community, as well as a small business investment fund. Small businesses in Durham, as they are everywhere, are being particularly hard hit. They are the backbone of much commercial activity and business activity and economic activity in the city, and Duke is making a commitment, and we're going to catalyze other commitments to help out with that. So I could talk. There's much more going on. Every one of these branches has 1,000 sub branches of things that are going on. But I would say, just to wrap up, as an anchor institution, as a deep and embedded partner within the Durham community, I think we are, as a community and as a university, we are very well served by each other and the work that's happening together to both keep Durham healthy, keep the people of Durham healthy, but also provide a strong foundation for this community as we go through, fill in, apply your favorite cliche, unprecedented, and mine is discombobulating circumstances, which is certainly what's going to be the case for a while.
Thank you both for those opening remarks, but also for the extraordinary work that the city's been doing and that Duke has been doing to, mitigate the impacts of this, as you said, Mike, truly unprecedented global pandemic that we've been facing, even with the seemingly forever of end of December or January of working on this, which feels like a different universe or a different lifetime ago, I'm sure, to you all and to many of us who are joining here today. It's really not that long ago how radically our lives have changed and how radically our expectations have changed. I wanted to guide us through a couple of different questions to begin with, questions that have come up both from people who've submitted them in advance, but questions that I know that are top of mind for people, which is to begin with, and we'll take these kind of one by one, how successful you feel like the mitigation efforts have been one of the things that's challenging that you hear at the national conversation level is the more that we feel like it's a non-event, the more successful it's been, but a more chance for people to truly understand the importance of social distancing or the other measures that are taken into account. And so, if you feel like you're looking around and saying, like, why are we doing all of this? That's good news, and that would mean that it's successful. But I wanted for us to start with how successful you think the efforts have been. The second, which is, how do we think about, and how have you been thinking about, and you've alluded to some of this and given us some of the specifics, Mike, but how do we deal with some of the broad health and economic impacts of the decisions that we've had to make and that you've had to make in order to mitigate the effects? And then how does Duke and Durham move toward the next phase of the pandemic? How does it do so in a coordinated fashion, and what are some of the ways in which it's planning to do so? So why don't we start with Mayor Pro Tem Johnson with how successful you feel like the efforts have been, in particular for Durham and for North Carolina, rather than looking more nationally, where I think it really varies based the individual state or city or county.
Sure. Thank you. So yeah, Durham has done pretty well. We have some really good analytics based on cell phone data, which I know there have been some, concerns about how everyone is being tracked everywhere via our cell phones. It's been, we know that we're being tracked all the time being our cell phones, but now it's like that information has become, is being used in so many different ways. But it has been very useful to track the success, the compliance with and the success level of stay-at-home orders. So based on the analytics that we have now, Durham is doing very well. We're one of the top counties in the state for folks staying at home, reducing their shopping, their travel only to essential purposes. So that's been good. We, based on the information that we're getting from the Duke data analysis team that Dr. Schoenfeld mentioned, we have seen our curve flattening. So we've done that. Our hospitals have not become overwhelmed. We haven't exhausted the capacity of our healthcare system, which is always the biggest concern in terms of dealing with the potential mortality of this virus. If everyone has access to high quality healthcare like you would get at Duke Hospital, then we know that the mortality rate is going to be greatly decreased. So in a lot of ways, I think Durham has done well. Where we've seen issues, and where a lot of communities have seen issues, is in congregate living facilities, and places where people are living very close together, like long-term care homes, nursing homes, jails, homeless shelters in Durham have been emptied in order to prevent outbreaks there. So those are the spots that we're monitoring closely and trying to make sure that we don't see additional activity. The county has recently moved all of the occupants from urban ministries into hotel rooms in order to allow for social distancing, which wouldn't be possible in a homeless shelter setting. So I think overall, we feel pretty good about where we are. We have, of course, seen a number of deaths in the community, which is tragic, and we would our hearts go out to the families and the people who are sick and who are suffering. But overall, we have our numbers have not been as bad as they could have been. They've not been as bad as we predicted they would be without the intense interventions that we made early on, with being one of the first communities to pass a stay-at-home order that was more restrictive than the state's order. And so we're, I think overall we've done well. Of course, now, we have to deal with by prioritizing public health, there are some other consequences that we now have to deal with, of course.
So, Nita, if I could add to that, I absolutely want to endorse what Mayor Pro Tem Johnson had said about Durham doing well. We start our day just like I'm sure as Mayor Pro Tem Johnson does as well. We start our days at about 5 o'clock in the morning with a view of what's going on in Durham, statewide and nationally, and then progress throughout the day on all the decisions that have to be made. The very early activity, I want to credit Mayor Schewel and the City Council and the County Commission for really stepping up and stepping in. at a time when it was absolutely necessary, and when there were probably some greater challenges at the state than were known at the state level, with putting Durham on a very good path. A very good path, certainly from our perspective as a healthcare provider and as an employer. It is too early. I would say it's too early to take the foot off the gas, to mix various metaphors here, but nonetheless, we are much in a much better position in time on Friday, April 24th, than we had expected to be 3 or 4 weeks ago, and certainly than we would have been had some of those strong measures not in place, and had there not been significant compliance within Durham. The challenge for all of us, obviously, is that this is a bit of an island, and we have wide variation across the state and across the country, and that too has a ripple effect on communities like Durham. So it is far too soon to declare any kind of victory. But we are certainly able to move and talk about restoration of activities in a way that it may be reasonable. Nothing for the immediate future will look like it did before. March 11th is being identified as sort of the day everything changed. I just was reading an interesting article about that. Anything before 3/11 is going to look very quaint and very nostalgic once we do get back to work. The other thing I would just add is, I think for all of us, as we think about making connections and partnerships, we're all still in a state of shock. To deny that is denying the obvious. Many people are functioning extremely well and very productively, but we are, as a community, as individuals, as a university, as a city, as a government, we are in some combination of shock and grief, and that obviously affects all of us and everybody in very different ways.
Yeah, I think that's absolutely right, is that, in the early stages, which is where we still are, unfortunately, right, that the shock and the grief are ones that people are operating but not able to really fully process and understand the full enormity of what they're facing, which I want to turn our conversation a little bit toward, the great success we're having, I think, on flattening the curve and not overwhelming the system and limiting the really early deaths and fatalities within Durham are terrific. The economic fallout is also extraordinary. And I know that Duke is one of the largest private employers, second largest here in the States, but also, as a major institution is facing economic hardships. I know that it's social distancing differentially affects people. Some people who are able to work from home more easily are able to suffer less economic impacts. The unemployment rates are, at rates we've not seen since the Great Depression. The suffering that people are experiencing from the secondary effects or the tertiary effects of both the policies that are necessary are profound. And so, how is Duke thinking about that? How is the city of Durham thinking about that as we look at small businesses and others, certainly relief that's coming from national levels, but shuttering of businesses and loss of jobs, furloughs of employees, it's profound. And so, whichever one of you wants to take that horrible question next, which is to talk about how you're navigating through these difficult times, understanding the profound additional impacts that it's having on the citizens and employees and students and others would be great.
Mm-hmm.
Well, I'll start, and I'll probably have the same answer that Mayor Pro Tem Johnson has, which is at some level we're still doing it. This is a story, if you will, that is still being written. Certainly for Duke, we have never as an institution, we have never, or as any institution, we have never confronted a situation like this in which every part of what we do, healthcare, education, delivering services, investments, things, everything that we do is either frozen or shocked all at once, all at the same time, and in every part of the our activity. So we are still assessing what the impact will be, both in terms of from a dollars and cents standpoint, in terms of additional costs and revenue that will be foregone. It will be significant. It will be notable. It will have a direct impact on the university and the things that we're able to do and how we're able to invest when you shut down, pretty much all of your construction. We also know that, for instance, that has a ripple effect on the community and on the state. So the short answer is we are still assessing it like every other business and like every other, and I know that the impacts of this on local government and state government will be dire. We're all going to be going through a period of some sort of retrenchment, but also working together to protect the most vulnerable in our community, and the Duke community, and the Durham community and beyond. And also working on the rest, what will essentially be a restoration effort. And certainly Duke is absolutely committed to being a partner with the city and with the community. I've had several conversations with Mayor Schul over the last couple of days about the ideas that for people and institutions to get engaged with that. I know many others have as well. So this is a community that does things, and
Mayor Pro Tem Johnson, what about on the effects on the city economy and how Durham is navigating this? I suspect the unemployment filings here are astronomical, and
yeah, it's dramatic. I mean, we are having a budget meeting actually today, just after this meeting, where our budget situation from our last meeting absolutely no resemblance to the situation that we're going to be receiving from staff today. We none of the members of city council right now were in office during our last major economic crisis in 2008. Luckily, our city manager was here, and so we're going to be able to benefit from that experience. But none of us have governed through this kind of economic disruption before. It's really revealed the fragility of the entire system, right? We talk about so many Americans not being able to cover a $400 emergency or living one paycheck from poverty. I feel like we've found that our entire economic system is just one paycheck from poverty. And so the city's largest revenue source, tax money, right? We get about 50% from property taxes and about 30% from sales taxes. And so of course we're expecting that sales tax revenue to plummet. We're going to have a really big budget gap. And at the same time, our community is more in need. Our community is more in need of the kinds of resources that the city usually provides in terms of housing and the kind of care that we are able to give to residents during these times. So we have a rainy day fund, and it's certainly rainy out there. So we're going to be able to dip into that to try to meet some of the needs that have come up. But doing the kind of economic relief that we really need to see in our community is not going to be able to depend just on our city's resources. We're going to need resources from the state, from the federal government, and from private institutions to really meet the need. And so we're really glad to see Duke stepping up to provide those grant funds that are really benefiting our nonprofits and the upcoming one for small businesses. We're waiting for some of the funding from the CARES Act to see how much we'll be receiving. Because Durham is under 500,000 residents, we're not going to be getting that direct city grant that was provided in the CARES Act, but there may be some money that will pass through the state that we could try to get. So we're really looking for resources. We know that our city's resources are not going to be enough to meet the needs in the community, and so we're trying to figure out how we can bring some more resources into the community and do more for our folks. But yeah, the unemployment situation is really stunning, and it's going to take a while for people to get back to where we want them to be.
Well, one pathway forward is to try to have some reopenings, right? And as Mike mentioned, it's still too early, right? I mean, at the very least, we have our stay-at-home order extended through May 8th, right? And
15th in Durham.
May 15th in Durham, and likely, you know, as it's already been said. But that's a nostalgic view of the world, right? We're not, it's not as if once there are reopenings, suddenly we're all going to be crowding into restaurants and crowding into classrooms and, you know, hugging one another and high-fiving each other, that it's all over. So, you know, what does it look like? How is Duke and the city coordinating? And, you know, what does the next phase, the slow reopening phase, which is one form of relief, right? Which is when people are able to participate more in the economy, participate more in their education, and participate more in, you know, the kind of freedom of movement that this pandemic, this virus has really robbed us all of. What does it look like moving ahead?
So it's a great question, and it's one that, again, it is being written and rewritten as we go along. So I can speak for Duke's case. You know, on one hand, we still have 15,000 people coming to work every day in our hospitals and clinics. So there is a lot of activity. We have utilities. We have hundreds of people, you know, taking care of utilities and facilities providing student health for the students who are on campus and elsewhere. So there's still there's a fair amount of activity. Obviously, nothing at all like a normal day or a normal time. We're looking at a range of options, right, and planning for a range of options across the board. And those options could be business as usual on one end, or no business, very unusual on the other end. It's impossible for us to predict today what things are going to look like a month from now, 6 weeks from now, 8 weeks from now, 12 weeks from now. So we have to prepare for a number of eventualities. We also overlaid in that are things like what will be the public health and safety guidance. What will be the local and state laws and regulations and that will be in place at the time? How do we reconfigure our facilities to deal with things like distancing? How do we deal with travel? Because as a global institution, we've got people coming in from all over the country, all over the world. Testing and contact tracing. The vulnerabilities of various populations, both by age and other illness and other distributions. So, a lot of big question that I don't think. What do you do with large events? What do you do with sports? A lot of things that I don't think that we're not. I don't think. I know we are not in a position to determine just yet. What we're saying is that we hope to be in a position to have some clarity on that by the middle of June. And likewise, when the stay-at-home orders get lifted in May 15th, that doesn't mean everybody get in the car and come to the office on May 16th. We still have a lot of work that as an institution that we need to do to first and foremost protect the safety and the health of everybody who is involved. Preserve our and protect our healthcare providers and our healthcare facilities, and have some pathway towards resumption of as many of the things that we do as we can have.
Hey, for Tom Johnson, what about on the Durham level, thinking about those issues of reintegration, the slow reintegration, what the world might look like? And I think it's absolutely right to say all of these are, you know, it's one step at a time, one day at a time. That's how we're having to deal with these things. The models keep changing, the predictions keep changing, but we do know the longer that things stay completely closed, the greater the economic impact, at least on the small businesses and individuals who are unable to work from home
Right.
as they were before.
Yeah, absolutely. And we are, you know, we're listening to experts. We're getting all the guidance that we can here in the city. We believe in science and we believe in experts, and we listen to doctors. And so I think our residents can trust that we are going to be using the best possible evidence to make the best possible decisions that we can with regard to restoring economic activity as quickly as we can do in a safe way. We are continuing the stay-at-home order for a number of weeks, and then, of course, we'll reevaluate that. I think that will gradual kind of process. And the governor actually in his press conference yesterday laid out a series of like a phased reopening process that I thought was a really good framework guidance, you know, and allowing slightly larger gatherings for a period of time and then watching what happens. You know, do we see more outbreaks? Do we see more clusters? Do we see more hospitalizations? Everyone is very aware of the possibility for another peak. We've seen that before in other pandemics where the suppression measures take effect, everything goes along smoothly for a while, and then when everything goes back to normal, you see an increase in another peak. And of course, in the 1917 flu pandemic, 1918, that second peak was worse than the first. And so we recognize that the potential public health consequences of that, the loosening of restrictions, economic reopening could be quite severe, and that there are also economic consequences to that public health impact, right? It's not a either or choice between leave everything open and the economy is fine and close everything. And, you know, the leaving everything open scenario also has really severe impacts on the economy. Not that that's the thing that we should most be concerned about, of course. The cost in human life and human suffering is far more important. But yeah, as we're moving toward the next phase, you know, we really need resources and economic relief for the businesses and for the individuals who have been out of work and have been forced to close. And again, the city's resources are not going to be enough to meet that need. We really need the federal government to step up and provide states and cities with the kinds of resources that we're going to need to keep going. The several packages that have passed already have been good, have been helpful, but we have not received the kind of the level of resources, the level of relief that we need yet from the federal government. And those resources have not been targeted to the people who need them the most. And so that policy is going to be really critical to how quickly and to how well Durham can recover. We'll continue to evaluate. You know, we get new information, new science every day, and we're still learning how this virus moves, how it affects people. We're not completely sure, you know, how immunity is conferred by infection. You know, right. There's so many open questions. So we'll be, you know, taking it one day at a time, and we want to make sure that people can get back to work, can get back to their normal lives as quickly as possible. But we need to make sure that everyone is going to be safe while they're doing that.
It seems like any of these, which is something you would mention, and Mayor Pro Tem Johnson had mentioned, which is for any of these scenarios, adequate contact tracing and testing seems critical. And so I would love to understand just how well we feel like Durham is positioned, Duke is positioned to be able to engage in that. And Mike, you wanted to respond to something first. So
I'll answer that question very quickly. We're still trying to figure that out as well. You know, we have been doing it at some level for a while with our workforce. So again, within the workforce, principally our healthcare workforce, we've been doing the testing and contact tracing. How that gets scaled up when you're talking about now thousands of employees, thousands of and more of students on a regular basis, it's a great question. I don't have an answer for it right now, and we're trying to come up with it. The two things that we shouldn't underestimate the value and the power of innovation in what this recovery is going to look like. And I'll give you two very quick examples. On March 11th, we taught a grand total, except for our Duke's online master's programs in business and engineering and a couple of other places, sort of small boutique programs, we taught a grand total of 0 online classes. I'm pretty sure the law school taught 0 online classes. In a very short time, we transitioned 6,500 courses taught by 1,500 faculty. Now, they're not all, they're of widely varying kinds of classes and quality, and they're not all on Zoom, everybody looking at Zoom, but that is a major, major transition that has been debated and discussed for 25 years, and it took place not under the best of circumstances, obviously. That's going to have both implications and opportunities for the university and for the community and beyond. The second thing, I just heard this, we're reviewing this data early this morning. For the month of January, Duke Health had a grand total of 107 telehealth visits. So as for the month of January, 107 people used our telehealth service. On April 23rd, 7,000 people used our telehealth service. So that's going to be a radical and dramatic change in the way people get healthcare, in the way that people access healthcare and health advice. That's going to that'll have long-term implications well beyond when we're done with social distancing. So, you sort of take those two very small, relatively small data points, and you can see that there's a lot of innovation yet to come that could potentially address some of these issues. Not all of them, certainly, maybe not even most of them, but it is there.
Well, that raises one of the questions that was submitted actually by the participants here today, which is there is so much innovation, I think, that's happening online, which is terrific. There are great opportunities that we can always find out of such terrible times, and it is terrific to see those innovations happening. But access to internet and cell services are really an essential way for people to stay informed, to work, to study, to access healthcare going forward, to keep in touch with one another. These are not utilities, at least until now. But increasingly in this pandemic, it's becoming obvious that unless you have access to those services, you may be excluded from really adequate participation in society. And so how is Durham trying to move to ensure access to internet and cell phone services for families that are facing ongoing financial burdens? And how is Duke trying to reach its students who have differential access to internet and cell services depending on where they are in the world? And since I know we only have Mayor Pro Tem Johnson for a couple more minutes, she needs to go off to her budget meeting. I would invite you to address that and anything else you want to before you have to leave us to go address the issues for the city. So
thanks. Yeah, that meeting is going to be a rough one.
Yes, I'm sure.
So yeah, I mean, I think the situation is a great argument for broadband as a public utility, right? To guarantee everybody access to these communication tools that have become so incredibly important. Though the primary way in which I've engaged with it so far has been through our school system, which is working really hard to make sure that all of the K through 12 students who are now learning from home have access to resources. There are some families where there may be a device in the home, but the only device is, mom or dad's iPhone, and they're sharing it amongst, a number of kids. So making sure that we can get kids the technology that they need to engage. There's a huge concern that this is going to exacerbate existing inequalities in education, because we know that kids of color and low-income kids have lower access to this sort of technology, and that's going to mean they fall further behind. And of course, they're already behind their white peers in a number of measures. And it's a huge problem in Durham, that racial gap in outcomes. And so that's something that we're thinking about a lot, trying to figure out ways to attack that problem. We're just we're in a real bind. You know, public broadband is actually not legal in North Carolina. Cities cannot set up their own broadband networks. And so we're in a lot of ways, you know, those sort of state restrictions on cities in North Carolina and a lot of other cities with really restrictive state governments are going to be barriers to the kind of innovation that we want to see in Durham. But I feel that there is a real opportunity now that these needs have always existed. They've always been there, but they're being elevated and brought to the forefront in a different kind of way by the pandemic and by the situation that we're seeing now. There's a real opportunity to solve them problem. You know, they're not unsolvable problems. They're things that we to deal with as a community. And so now that they're getting so much more attention and the impact of not solving the problems feels so much more immediate, I'm hopeful that we'll be able to move forward with some of these issues that have honestly plagued our communities for a very long time. And I'm so sorry I have to leave early.
No, we're grateful for your time with us. So
yeah,
thank you.
Thank you so much for inviting me. I was looking at some of your upcoming talks and try to come back and see more about what y'all are sharing with the community. But yeah, we appreciate the work that you're doing and our collaborations with Duke. I've been really valuable for the city during this situation, and I'm looking forward to continuing to work with Duke and with our other governments to move through this unprecedented moment in our community's history. So
we're so grateful for your engagement today, for your hard work that you're doing on behalf of all of us, and thank you for being here with us today. Really appreciate your time. Good luck with your very difficult meeting ahead.
Thank you. Bye.
Bye. Mike, if you don't mind, I'm going to turn to you with another question that builds on what you had actually just raised. It's a question that was also submitted. For a long time, people have been talking about distance education, online education, mixing flipped classrooms. There was the Coursera model that everybody believed was the end of higher education, which turned out not to be true. But clearly, what's happening today is going to have lasting effects, right? I mean, the way we're going to think about delivery of content creates new opportunities. I think a lot of my colleagues who had never used a PowerPoint or a computer for delivering content are discovering that there's a lot of terrific tools that they can integrate into delivery of educational materials. So I think that there's a lot of innovation that's happening, but it may fundamentally change undergraduate and graduate education. It may fundamentally change how we think about higher education going forward. And I'm sure that, we're so early in the pandemic to be thinking about what the long-term implications are, but if you can speculate a little bit about what you think term and potential longer-term implications for higher education may be from the pandemic.
Yeah, great question. I don't want to be too rose-colored glasses, and I don't want to be too apocalyptic. So a short interim answer is we're still learning that. I don't think anybody would argue or try to make the case that what we did as a university, pretty much what every university did over the course of 10 days or so, the ideal or perfect or even best way to integrate technology and to change learning models. It was certainly it was a catalyst and a very valuable. So I think that my guess is that you're going to see some much greater acceptance on the part of the educational establishment as well as students and parents and others for greater use of high quality interactive online or remote delivery kinds of programs. Imagine more of the kinds of hybrid programs that that Duke has particularly in graduate education and in master's degrees, where people come and spend a short period of time on campus and go and then have a semester of online learning and go back and forth. So you can see some of that. I think this will accelerate and perhaps even solidify the notion that a college education is a lifelong commitment and a lifelong education. So right now it's in the traditional sense, although there's relatively few traditional college students these days, pressed into 4 years. And you sort of pack everything into those 4 years, and then you go off and you live your life. There are many other models, both business and otherwise, that say that your education is going to continue as you continue to change careers and evolve and change. So why should that relationship be 4 years of education and 50 years of going to basketball games? That's going to be, I think that model is going to extend. If you look at, and we've actually been looking at this for a while. If you look at, we have a very strong partnership with the National University of Singapore in Singapore. One of the great universities of the world, probably the best university in Asia. They have, over the last couple of years, they've implemented an institute practice where when you go to the National University of Singapore, you're basically admitted for the next 20 years, not for the next 4 years. So you can complete your degree, but you can also be you're sort of considered a student for a fairly long period of time. And how you access the education, how you develop credentials, how you reinvent yourself. We sort of do that in some ways here, but this is clearly going to accelerate it. It's also something that that President Price had actually identified several years ago as a very important strategic priority for Duke going forward into the next century. And then the last thing I'll say is just from a process standpoint, we have all of the work that's going on that I mentioned earlier to prepare for 2020 and 2021 and what is that going to look like. But the President has also created a completely separate planning team task force that's charged with identifying what are those things in 2030 that as a university and as higher education we will be doing. How do we organize ourselves? How do we structure ourselves? What are the ways in which what are the priorities? What are the tremendous opportunities for the university, and what are the potentially the liabilities? So that this has jump-started, and I suspect it's being repeated at thousands of colleges around the country. This has jump-started that kind of thinking in a way that clearly no normal time would have done.
So my stress dreams that I have not gone to class the entire semester and sitting for an exam may come true if we've got 20 years of lifelong learning and I in fact have shown up to my class, right?
Yeah, you got the next 20 years of waking up in a cold sweat because you missed it. You're late for the test.
That's right. Well, it's interesting because you mentioned the delivery of content that it may be quite different. I think that the models that were being stood up much earlier than this sudden shift to online were a lot of prepared lectures that were put up online, asynchronous content that were kind of short segments, but very little interaction with the students. Whereas a lot of, I think, what I've seen my colleagues delivering, and I think a lot of people have been attempting to deliver, is something that is a hybrid, right? So there may be some things that are prepared in advance, particularly for students who are unable to necessarily be on the same time zone or on the internet at the same time as the rest of class, but that there's a lot more face-to-face interaction with their colleagues, with their faculty members. But part of the experience of college to date, part of the experience of universities has been the social experience. It's been, camping out at Duke for a basketball game. It's been, the kind of close dormitory residential experience that people have had before. So I think there are certainly going to be changes in lifelong learning and changes in how people access the kind of classroom content. But I think one of the things that a lot of our students are asking and missing so much is the residential experience, the buses, the camping out, etc. One solution to that, a small one, but is not an adequate solution, but at least is probably part of our future, is everybody wearing masks and probably increase in distancing. That'll be hard to do in in camp outs, right? And to have something like that. And so what are the things that you're, I guess, as you think about your nostalgia from pre-March 11th, what are the things that you think you're going to miss most in the short term?
Well, I don't know what the midterm or the long term is going to hold, and I recognize, as I know you do, that there are many different kinds of colleges, universities in the country. This is, the economic stresses alone are going to create a shakeout for some number of those almost 5,000 colleges and universities.
Yeah.
Duke is very fortunate in many respects. We have been for 100 years a great residential research university. We're going to continue to be a great residential research university. How we do that and what we provide is going, and what we do is going to be still along the lines of what we have done before. But we're sort of already fraying and missing the opportunity to drop into the office. You're in my building or I'm in your building. It's like, hey Nita, how you doing? Let's have lunch, and then we'll come up with like 7 different interesting ideas. 2 of them may be worth pursuing. One of them you can actually implement, and that made it all worthwhile. So I am not ready yet to say we're all going to be digital, we're all going to be virtual, and everything is utilitarian. Because that's not the university that I signed up to work for. I don't think it's the university you signed up to work for, and it is absolutely essential. The universities are the essential institutions of the 21st century, and I believe that even more passionately today. Look at who's on TV and who's on the internet. Who are the most trusted experts? They're going to be there. We're still going to have a significant role in the community. So I don't. It's a great question. I don't know what the answer is, but I do very much look forward to getting back to seeing people, interacting with people, looking for ways in which we can bring our community together, and also to revitalize, to energize again the traditions. And I'll mention one, which I hope there are 68 people on this call. I hope all of you have had the opportunity to listen to 5 o'clock Carillon at the Duke Chapel. It's been going on. I came to Duke in 1980 as a freshman, and it was going on long before I was here. That is we declared that an essential service. I'm not sure we didn't check with the vice mayor on that, but we declared that an essential service. Yeah. And the University Carillonneur every day goes up to the top of Duke Chapel and does a 15-minute concert, which you can listen to and watch live on Facebook, on the Duke Chapel Facebook page. That kind of community building and those kinds of traditions, whether they're synchronous or asynchronous, they're still going to continue.
Well, there is a lot that we're missing from our nostalgic pre-world. I am optimistic that the and it will introduce along the way will lead us and guide us to a post-pandemic world that we're all going to celebrate and enjoy. But we're grateful for the incredibly hard work and stewardship that you're showing for Duke and for the community, and for Durham and the interaction with Durham in guiding us ahead in this. So thank you for joining us here today. Thank you for all of your extraordinary work that you're doing on behalf of all of us, on behalf of Duke University, on behalf of Durham, and on behalf of the country and higher education that you're helping us through this. Thanks to everybody for joining us today. As Tim noted at the outset, we have a series of these conversations that are continuing and helping to explore each of the different facets of the global pandemic that we're facing. Please join us for our next coronavirus conversation. And I thank Mike Schoenfeld, as well as Mayor Pro Tem Jillian Johnson, for having joined us today. Thank you, everyone. Thanks.